Hi, my name is Joey Fadul, and along with Chris Anderson, we'll be presenting to you Prescription Decisions, a decision support system for Medicare Part D coverage options. This was developed from a need due to the rising chronically ill population in America, as well as the increasing percentage of GDP being spent on healthcare, leading to runaway healthcare costs in the United States. So let's go ahead and get started, and I'll take you on a walkthrough through Prescription Decision. First, we have the patient information page where the patient is asked to fill out general information, just their name, their age, and their gender. We'll note that the state has been set static to Virginia, as this decision tool is only focusing on Virginia-based coverage plans. Moving on, we see the patient history page where the patient is asked to indicate which of the following chronic illnesses they're currently suffering from. For the sake of this example, we will choose cancer, diabetes, and miscellaneous other illnesses. Next, the patient is asked whether or not they're eligible for dual status. If they don't know what this is, they can simply click here and get a definition on what that is and determine whether or not they are eligible. So for the sake of this example, we'll say no, they're not eligible for dual status. Moving on, we have the insurance profile page where the patient is asked a series of general Medicare Part D insurance questions, which they will fill out. Next, they're asked what is the maximum they're willing to pay towards their monthly premium. Once they've done this, they'll scroll down and indicate how many prescriptions they're refilling for the chronic illnesses they claim to be suffering from in the previous form. And once again, if they have any questions on any definitions, they can simply click here and they'll be taken to an additional insurance information page where they can read up and get more detailed descriptions on all of these Medicare and Medicaid terms. Moving on, we'll have the user rank their top level insurance preferences in terms of plan cost, past customer ratings, and the number of drugs covered by the plan. For the sake of this example, we'll say plan cost is second most important, past customer ratings is third, and the number of drugs covered by the plan is the most important aspect of insurance coverage to the user. Now, once they've gone through these rankings, they can specify whether or not they feel any of these attributes are tied in terms of importance to them. For the sake of this example, we will not have any ties. And moving on, we break down plan cost into four more attributes, which are premium payment, gap coverage, cost sharing, and deductible. If the patient has any questions on the definition of these terms, they can simply click on the word and a more detailed description will appear. So once again, they rank in terms of importance to them. We'll say premium payment is first, gap coverage is second, cost sharing is fourth, and deductible is third most important. Once they've done this, they can scroll down once again and see the breakdown of the weights we've assigned based on their rankings and specify whether or not any of these attributes are actually tied in terms of importance to them. Once again, for the sake of this example, we will not have any ties. And moving on to our results, the first thing the patient will see is sort of a historical results section where we've paired the profile they've just filled out with past data and come back and given them the number of matches we found given their same age, gender, and chronic illnesses, as well as payment and prescription information for all profiles that match them, such as average yearly drug cost, average number of prescriptions per year, and average cost per prescription. We also give the user an age breakdown for patients with the same gender and chronic illness and show them where they fall in that data set. Moving on, we'll see the top 10 ranked prescription drug plans based on user preferences as well as the user specified monthly budget towards a premium. So the user can now compare these top 10 plans as they were deemed most suitable for them given their preferences. We move on to a cost breakdown per illness based on the number of prescriptions the user specified to be refilling. So for the sake of this example, we had a total of 20 prescriptions, giving a total drug cost of $1,206.90, assuming no insurance coverage. Now the user scrolls down to this graph here, where they can compare the top 10 ranked plans, denoted by the blue line on the graph, to the red line, which is the estimated out-of-pocket cost. So they can see what their cost savings will be on each plan given the coverages they provide. And for some plans, they can see a break-even point where the out-of-pocket cost is actually undercut by the cost to the insurance company, where they can see exactly what months they'll be saving money and breaking even, as well as what their costs will be at the end of the year. I will now hand it off to Chris Anderson, who will discuss our simulation with you.
Thanks, Joey. Moving on to our simulation, we wanted to make sure that the 30 Virginia-based prescription drug plans being offered would have a good ranking value for each individual user, being that we wanted to make sure that there would not be one specific plan or a few specific plans that constantly remained in the top 10. So what we did was design a simulation using Crystal Ball, which is a Microsoft Excel add-in to perform Monte Carlo simulation on the suggested insurance plans. What Crystal Ball does is it enters random values as inputs based on the assigned distributions. And as you can see for our coverage distributions, we decided to use discrete uniform distributions due to the nature of the rankings and the way that a user would rank them, either incrementally, 1, 2, 3, tied across the board, 1, 1, 1, 2, 2, 2, 3, 3, 3, or a few of them tied, so you would have 1, 1, 2. And as you can see down here for the Tier 2 attributes of the cost attributes, you have 1, 3, and the last two are ranked to number 4. And what we also have is a random number generation that compares it to our public health data and the health profiles, and it assigns them an age cohort, a gender cohort, and tells us exactly which chronic illnesses that person is suffering from. Moving down, we also ask the user to input their maximum monthly premium spending limit, and that is also a discrete uniform distribution 1 through 10, pops up randomly for each iteration of the simulation, whereby the output is in this column, and as you can see, the number 10 comes out with the banded ranking of $125 to $135 range. We have also decided that we wanted to implement a random number generation to choose a specific plan within the top 10. So at every iteration, it does not always choose the number 1 ranked plan. It does change. So what we're going to do now is step through an iteration of our simulation. And as you can see, the rankings are changing, the chosen plan is changing, and we are also capturing our estimated user savings on an annual basis. So as everything is running through, you can see right here, the health profile number 3088 is the age range from 80 to 84, gender of a male, and they are suffering from heart failure and chronic kidney disease. The random number generation for the payment max applies to the $75 banded range, and that's the maximum they're willing to pay on a monthly basis for an insurance plan. It randomly chose plan that was ranked number 1, which is the Health Net Orange option. And over the course of a year, due to the chronic illnesses that the user health profile is specified, they will save an estimated $1,268.91. And as you can see from our simulation and the information that Joey presented to you earlier, making this decision can be very complex. In order to make sure that our tool was easily used for each user, we designed a usability test in order to test the actual information that was given, and we wanted to see if the patient was able to use it in a timely fashion as well as answer some questions from the result. And here's how our usability test was administered. We decided to evaluate for the ease of use of the tool, or the intuitiveness, and the understandability of the tool. The usability test was administered to people with a minimum age of 55, as this is our target population, and the subjects were asked to participate in a timed run through the decision support tool, as well as complete a timed checklist consisting of 8 questions regarding the results, such as finding costs, interpret the graphical output, etc. In looking at the results of our usability test, we were able to conclude that the tool is easy to use and the results were easy to interpret, but the results tab was too complex to interpret given our original hypotheses and the stated time limit. Further work will be needed to take a look at the results page and make sure that it is easier to understand for the intended user. We want to thank you for listening, and we appreciate all the help, hard work, and dedication. I would also like to thank Joey Fadul, Anupam Menon, and Harold Terceros for their diligence in completing this project with me over the last 8 months. Thank you very much. Have a great day.